Just under 10 years ago, the World Health Organization proudly announced to the world that the UK had eradicated measles. Unfortunately today, vaccination rates are at their lowest in 16 years. Within the UK, England has the lowest rates, with only 60% in parts of London and 75% in parts of the northwest being vaccinated. The WHO states the target for vaccine uptake among children in order to achieve herd immunity is 95%. Consequently, measles is back. Measles cases are on the rise, and as are the complications. One child has died in Liverpool this year from a previously nullified disease. Now, Mike, where have we gone wrong here?
Been looking forward to this episode in a lot of ways, but also slightly apprehensive about it, because the temptation with this is to always look for the simple answers. So why are these rates of vaccinations suddenly dropping? And it's really tempting just to find a simple answer and say, look, it's all the misinformation online, or it's people not trusting healthcare professionals. But it's so much more complex than that. I find this topic quite emotive personally, and I know we're going to talk about our own views on these things, but I like to think of myself as quite a pragmatist and someone who can often see both sides of an argument. This is something I really struggle with, and I find myself having to consider more aspects to this than perhaps I have done in the past.
I totally agree. I've found this really emotive as well. A lot of the stuff I've read doesn't necessarily blame the social media, but yes, I worry that we're going to get a little ranty this episode, but I think bear with us. This is important.
Absolutely. So look, I think a really good place to start is to go back to the basics. So I'm going to give you a bit of background about vaccines, because I think it's actually really interesting stuff. And hopefully this plays into a little bit in terms of why perhaps objections to vaccines, where they have come from too. So let's start really basic. So a vaccine, what is it? It's a biological preparation that provides active acquired immunity to a particular infectious disease. Now, in simpler terms, what that means, a vaccine trains your body's immune system to recognize and fight a specific germ, like a virus or a bacteria, without you having to get sick from it first. Now, the history of vaccines is really interesting stuff, actually. So it's a new term for me. I don't know, Matt, if you've heard of this, but variolation.
Nope, never heard of that.
Never heard of that? No, me neither. So for centuries, societies used essentially this crude method called variolation to prevent smallpox. So this practice, I think, started in Africa and Asia, but actually spread to America and Europe in the 1720s. So it involves deliberately exposing a person to a small amount of what was usually pus or scabs from a person with a mild case of smallpox. This often caused a less severe infection and therefore offered immunity. It was risky stuff. So it still had a fatality rate of about 3% and could also spread the disease. It was better than the 30% fatality with smallpox, but still not something you would be hugely excited about doing, I suspect. Now, the real breakthrough when it came to vaccines came from a guy called Edward Jenner. So he was an English physician in 1796, and he observed that milkmaids who had contracted a mild disease called cowpox never seemed to get smallpox. So he famously inoculated an 8-year-old boy with pus from a cowpox sore on a milkmaid's hand. Try saying that 10 times. When he later exposed the boy to the dangerous smallpox virus, he didn't get sick. So this was the first vaccine as we now know to understand it. Interestingly, he coined the term vaccine from the Latin word for cow, vacca. So that was Jenner. We move on to Pasteur. So this was a French guy, obviously Louis Pasteur. He turned vaccination into more of a general principle. So in the 1880s, he developed vaccines actually for rabies and anthrax. And he really showed that by weakening or attenuating a disease-causing germ in a lab, he could recreate this vaccine that stimulated immunity without causing illness. So this essentially proved this fundamental concept of immunology and made vaccines this repeatable science. It was really in the 20th century where things really started expanding rapidly. So the polio vaccine came about, and it was in 1980 when the WHO officially declared smallpox as a human disease that had been effectively completely eradicated. So hugely successful, right? You must look at this and think this is the wonders of modern science. But as we know, as with any medical development, not everyone was convinced. And whilst it's easy to view this anti-vax movement as a modern phenomenon, it's really as old as the practice itself. So in the late 18th century, when Jenner was around, the concern immediately started to rise. So people were afraid of injecting animal diseases into human bodies. There were also some caricatures showing vaccinated individuals growing different parts of cows. We then move on to the 19th century, and actually a formal anti-vaccination league was created. So their concerns were not just about safety, but also about the personal liberty and the government overreach.
That's actually really interesting. So before the age of social media, there already was a lot of vaccine skepticism and hesitancy in the broader society.
Yeah, exactly. And I think it's interesting because, as I said at the beginning, we blame social media for this. And yes, it's no doubt that it plays a part, but people have been skeptical about vaccines for a while now, as we've demonstrated. Now, if we fast forward to 1998 and we have a new problem here, and this time it's in the shape of a British doctor by the name of Andrew Wakefield. So many of you will be familiar with this already, but this is a guy who published a paper in a really prestigious medical journal called The Lancet. And in it, he suggested a link between the MMR, so your measles, mumps and rubella vaccine, and the development of autism and inflammatory bowel disease in children. The study was based on just 12 children. Now, the findings from this, which essentially went, as we would now refer to it, as viral, they received widespread media attention. It ignited this global public health crisis. There was a massive drop in vaccination rates in the UK, the US, and other countries, and measles came back. And this was a disease, as we said, that had been close to complete elimination. Now, really important point, and I think one worth labouring a little bit, but these papers' findings over the next decade were completely debunked. So numerous independent studies involving millions of children found absolutely no link between the MMR vaccine and autism. Really, again, worth pointing out that Wakefield was not an honest guy. So he also had failed to disclose that he was paid by a lawyer who intended to sue vaccine manufacturers. He performed these invasive and medically unnecessary procedures on children, such as colonoscopies, without ethical approval. He falsified data and manipulated his findings to support this preconceived conclusion that he had.
Wow, God, I didn't know about all of that other stuff.
Yeah, so he got struck off as a result. So he can no longer practice medicine in the UK. He was last heard, believe it or not, cozying up to various high-profile figures in the US and dating Elle Macpherson, I believe. So make of that what you will.
That's a really great summary. And in my research, I found that people are still associating or still blaming the MMR vaccine for autism, and a lot of people use what they think is evidence because of the rising rates of autism and how the correlation between the introduction of MMR and the increasing use of the MMR vaccine and how autism is on the rise. Of course, that is a causal link, but as we'll get to in the rest of this episode, there's a very strong difference between correlation and causality.
Absolutely. And I think the difficulty here as well is that the diagnostic criteria for autism, they often become apparent in toddlers around the age of kind of 18, 24 months. And that's when they receive the MMR vaccine. So exactly that, the causation versus correlation here.
Now, I don't know about you, Mike, but I had pretty much forgotten about measles. It was something that I think we learnt at medical school. I then didn't see a single case, probably for 10 to 15 years. And then not until recently as a GP have I had to kind of relearn or revisit the idea or concept of what measles is, how it presents, how severe it is, all those kind of things. And that's because of these lower rates of people getting vaccinated that we're now seeing this disease. It's re-emerging. Now, measles is considered one of, if not the most infectious disease that we know of. In COVID times, I remember people getting a little bit obsessed about this R number, this kind of rate of replication or rate of infection. COVID, I think, reached a 1.7 number when it was at its peak in the UK. Now, the R number for measles is somewhere between 12 and 18 in a susceptible population. Oh. And that means that every one person that gets infected with this would be expected to then infect a further 12 to 18 people in a non-vaccinated population. Now, this is a respiratory illness. Typically, you'd have a bit of a cold prodrome, a runny nose. Then most patients would get a very high fever. It is characterised by quite a striking rash that then develops on the face. This can spread down to the body. You sometimes get these spots in the mouth that us doctors get quite excited about because it can be quite diagnostic.
Complex spots.
Very well done. Yeah, that's very well done.
Thank you. Yeah.
But this isn't a typical common cold. This makes people very, very ill. Even in uncomplicated cases or what we would consider mild cases, the patient would still feel significantly unwell. However, in severe cases, this is when it can cause things like pneumonia. And notably, it can infect the central nervous system. So this can result in convulsions, in blindness, or in a very severe condition called encephalitis. And it seems to affect most severely infants or adults who are immunocompromised or even pregnant women. Now, these people are more vulnerable to getting this severe form of the infection.
And it's probably worth reiterating there, Matt, exactly that infants are so vulnerable. This is particularly because they're not eligible for the MMR until they're a year old.
I'm glad you picked up on that, because the reason infants aren't vaccinated with the MMR immediately is because when a child is born, they share some immunity from the mother's immune system. This can last for a couple of months. And if you give the vaccine to newborns, it doesn't actually work properly. Their learned T cells, their learned memory doesn't actually utilize that vaccine, and then it doesn't actually generate this immunity that we need. So there is this window where they are quite vulnerable. Moving us on though, and looking around the world, places such as Western Europe, measles still causes death in about 1 in 5,000 cases. However, in the poorest regions, as many as 1 in 100 will die. Now, before widespread vaccination was introduced, this disease caused an estimated 2.6 million global deaths each year. That's huge, isn't it? It's worth mentioning again, I'm sure most of our listeners know, but when you have an infection with measles, there is no treatment then. There is no antibiotic that is effective. This is a virus. It is then only supportive care that we can offer. We do, however, have a vaccine. And these work, like you said, by protecting the individual from future infections. And it's just worth touching on what we talked about earlier about this herd immunity, or I think a better terminology for this is community immunity. I think herd immunity makes us sound like a pack of cows. The reason community immunity is so important is, like we said, those infants who are vulnerable. There is this window of vulnerability, and in those adults that I mentioned that are immune suppressed, or those women who are pregnant, there are vulnerable people in society that, for many reasons, can't get this vaccine, and they are reliant on the community being immunised so that this vaccine cannot propagate like wildfire.
Worth just reiterating that you said at the start absolutely correctly that measles, you need around a 95% vaccination rate to achieve that community immunity. That's not the case for a lot of other illnesses. So polio, for instance, I think the quoted figure is around 80%. Mumps is potentially even lower than that. But it really just reflects how contagious measles is and the need for that high uptake to actually achieve that effect.
I'm glad you started mentioning some other vaccines. That will lead us on quite neatly. Do you want to give us a bit of an overview on some of the other vaccines?
Yeah, definitely. So as I think most of us will know, it's not just measles and it's not just the MMR. So there's the whole immunisation schedule that your child will have and all of us will have had as we grow up, I suspect. Now, those are wide-ranging essentially, but they're illnesses such as diphtheria, tetanus and polio, which some of our listeners will be familiar with those, but they are horrific illnesses. And I don't know about you, Matt, I've seen a case of tetanus, not in the UK, but abroad, and I pretty much still have nightmares about it. It's one of the most horrific things I've ever seen. These are horrible illnesses, but they are covered with a routine immunisation. We also cover for pertussis, so that's your whooping cough, Haemophilus influenzae, hepatitis B. You get your pneumococcal, your rotavirus, your Men B, and a lot of these illnesses are ones that it's important to get as a baby because that's when you're most vulnerable. So rotavirus, for instance, if you or I or an adult got that, we would feel pretty awful, but we wouldn't likely be in significant risk, whereas babies get this and they really can get very, very sick. So they make up your routine immunisation schedule. Now, it's worth noting there are other vaccines that have been brought into this. So HPV is a good example. And that will happen more around school-age children. That's potentially going to eradicate cervical cancer. So there are new vaccines that are being found to be effective and being brought in. So it's not just about the MMR. Now, the other one that's interesting, and it's very on the nose because this is fresh off the press essentially, is chickenpox. And chickenpox has always been considered, and I'm sure it was when we were children, as a very benign, unexciting illness that caused a few dramatic spots and then you got better. There's lots of talk about these chickenpox parties where people would go and deliberately infect all of their children so they got it out of the way, didn't have to get it again. Now, I think that the view on this has changed, and that's because chickenpox is a reasonably significant illness. So it can cause a huge number of hospitalizations. About 20 people die from complications from chickenpox every year in the UK. And actually, if you, according to some US data, the chickenpox vaccination, which is much more embedded over there, it's prevented about 91 million cases. They think they've probably saved about almost 250,000 hospital admissions and over 2,000 deaths in the 25 years that they've been doing it. So this is really interesting. And I am very pro chickenpox vaccines. I will say that straight away. I think it's a no-brainer. A lot of that, I admit, is flavored by nasty things I've heard about people I know or people I know people who have had complications from chickenpox. So it can cause some quite nasty pneumonia. It can cause, again, encephalitis. And so actually from January 2026, it's now going to become part of these routine immunisations. So it's no longer going to be the MMR. It's going to be the MMRV, and that V is for varicella, which is the medical term for chickenpox.
I agree. I'm pretty pro this. Me and my wife were talking about getting paying for our kids to have this vaccine. Neither of our kids have had it yet, we don't think.
Yeah, we've had both of ours done.
You've done it?
Yeah.
The other lens that I thought was really interesting is that they'd modelled the financial or the economic implications of the vaccine versus not, and how much money might potentially be saved by people not having to have days off work. So, when your child has to be off nursery because they've got chickenpox and, someone has to then call in sick. I can't remember the exact figure, but it's a huge amount of money that they're anticipating saving by just preventing children from having this time where they have this awful, nasty, itchy rash. Another thing I want to mention, which is maybe a topic for another episode, is I skim-read a paper that was discussing the risks of dementia that was associated with those who'd been infected or had a nasty case of chickenpox. Now, it's probably a topic for another episode, but I think there's some really interesting stuff in there.
I think there's also, I believe, and apologies if I'm just making this up, but the shingles vaccine, so shingles is a reactivation of that chickenpox virus. The shingles vaccine seems to have potentially some protective factors in terms of development of dementia. So it may well be the same paper.
And that's a hugely misunderstood area at the moment, isn't it? These theories about the activation of dementia and how we know about some of the risk factors and the lifestyle measures, but there's a lot of that we don't really understand. So I'm keen to learn more and read more research on that when it comes out.
Yeah, absolutely. Now, we've talked about some changes to the vaccination schedules, but actually over the last few years, there have been some pretty drastic changes to the vaccines themselves.
Yes, absolutely. Okay, let me tackle the big one here. So we're talking about COVID, aren't we? Now, like you say, new vaccines were rolled out in 2020. And I think if you'll forgive me to kind of revisit the memories, I think it's important that we just go back briefly. So COVID, of course, it was a very unique time. We had a global pandemic. The word, I think, unprecedented was in pretty much every news headline I read. The lockdowns, the social distancing, the masks, these were our only tools to combat this new terrifying disease that had gripped the entire globe. Now, these were helpful in controlling waves, but obviously our policymakers worldwide, they were desperate for better ways to neutralise COVID. They looked to vaccine makers and offered them huge sums of money to develop these. It is the messenger RNA, the mRNA vaccines. These were the new ones. When I say these are the new ones, these have actually been around since the 1960s. And these are little strands of DNA that when entering a cell actually activated new pathways. And there was a problem with these proteins is then that they would just degrade if injected or if ingested. But scientists did develop these new fatty envelopes that acted as vectors that were able to deliver this really critical DNA into the cells where it was needed. And this was developed for Ebola. But I don't know if you remember, this was quite a small regional crisis. And because of this, these vaccines were never really developed at scale. Now, fast forward to COVID times, 2019, 2020, this awful virus arrived, and all of a sudden we had scientists and world leaders trying to develop new vaccines in 1 year instead of the typical 10 years. And of course, this was a monumental task. This was done by allowing clinical research to run in parallel rather than the usual linear fashion that's done for the steps of this vaccine development. $8 billion was spent on the COVAX alone in 2020 to 2021, and this achieved 2 billion vaccine doses globally. Now, you might think that sounds very costly, but again, going back to this kind of economic modelling, it was justified by the $375 billion that was being lost from the global economy every single month due to the pandemic, let alone the lives that it was going to save. This led to scepticism around the vaccine, the speed of which it was being made and then pushed upon the public. Also, this new class of vaccine, this mRNA vaccine, also led to some scepticism. We started witnessing some symptoms And these were produced immediately after the vaccine. And then there are also these genuine complications of the vaccines. Now, I don't know if you remember, Mike, but I remember hearing and reading about some really, really powerful anecdotes. And these, at the time, these were young people. These were young people who'd been given the vaccine, and they were getting nasty conditions like myocarditis or young women getting clots in the brain. I remember when this all came out, with the skepticism that I've just outlined, I remember the public concern around this, that, this became palpable. And I think as clinicians, we were being asked some very challenging questions like, how can a child that is at very little risk due to this virus, you are now giving them a vaccine that could, in theory, make them actually very poorly, critically poorly. How can you justify that? I remember having cousins texting me being like, should I get my son vaccinated, and having to actually kind of really think on this and really tread carefully. And I think it's important to acknowledge here that anecdotes can be incredibly powerful. I felt that myself. Hearing of someone's complication, this can have a kind of visceral impact, can't it?
Absolutely. And actually with the benefit of time, I've come to accept that. I think I would hold my hands up and say I was pretty dogmatic at the start. I was, as was everyone, so desperate to find a way out of the whole lockdowns that we were in, that as soon as these options became available, I was really pushing these. And yes, I said, okay, yeah, there are going to be complications, but they've been thoroughly tested. But actually, with the benefit of hindsight, I think I can look back and think, as you say, these examples that we saw were really heartbreaking and were really visceral. The goalposts seem to be moving every day. I remember writing a whole FAQs about the COVID vaccine for our patients at the time, was saying how there's no link to any blood clots. All of this is all conjecture. And then pretty much the next day having to throw the whole thing in the bin because they had actually found some concerns that were valid. And these were really kind of very fast moving times. But I think very important to mention that. I think, as we will come on to, I do wonder whether that has then had a knock-on effect in terms of people's general views on vaccines.
I remember getting my first COVID vaccine because I was working on a psychiatry ward at the time and had lots of poorly patients. But I remember getting it and then kind of forgetting about it because I had a busy day. But then the drive home, I remember just progressively turning the heating up on the car to the point where I arrived home, the heating was on full blast, on maximum, and I hadn't really realised that it had just kind of slowly gone up, a bit like this frog in a pan of boiling water. But I hadn't realised until I got out of the car and going from the car to the front door where I'd gone into the fresh air. It wasn't even particularly cold. I went into this huge rigor. I was like shivering and shaking, like my teeth were chattering. And I imagine that a lot of our listeners can kind of remember those kind of side effects that you might have got. Remember that night, I thought I'd been injected with COVID. Like I was like, something has gone wrong here. Like I feel so poorly. And I drenched the bed through to the mattress. And then I woke up the following morning and I felt absolutely fine. And I thought, what on earth has just happened? I'm a doctor advocating for everyone to get this vaccine, but what on earth just happened to me overnight? And I think that just highlights this huge uncertainty. We had Boris Johnson, as trustworthy as he is, leading the charge. And these were all just done on forecast. There was no historical evidence. This was, like we say, unprecedented.
I was hoping we were going to get through the whole podcast without us mentioning Boris Johnson on it, but we failed. My own claim to fame that I would like to add, and this is completely unproven, but I, as with a lot of healthcare professionals, one of the first people to get a COVID vaccine, and certainly one of the first young people to get a vaccine. And I remember getting the vaccine and then sticking on my running shoes and running 28 kilometers down the river immediately after having had the mRNA vaccine. And I like to tell people that I was the first person to run a half marathon after getting the COVID vaccine. It may not be true, but I would like to continue to claim that.
Well, thanks for that really important insight for our podcast listeners.
I think it is worth pointing out that the COVID vaccines, for all of the concerns that we raised, they saved a lot of lives. And it's difficult to find exact numbers on this. There was some landmark modelling that was done by The Lancet in 2022. They estimated almost 20 million deaths worldwide were prevented as a result of the vaccines in the first year of use. Now, more recent research, there was a global analysis, suggested that figure was more around 2.5 million. There was then the WHO did some research that suggested more 1.5 million, but big numbers regardless. So for the negativity or the concerns about this jab that absolutely do have some validity, it is worth mentioning that they fundamentally saved lives.
Absolutely, yes. The point I was going to come on to is that, that with everything, there is a risk and a benefit. And the risk here, because it just felt unknown, because it was unknown, but the benefit, like you've quite nicely just highlighted there, the benefit of these vaccines was huge. An unparalleled success. These vaccines really, really kind of saved, like you said, millions and millions of people. So, Mike, I've talked a lot about the COVID vaccination and the risks and the benefits here, and maybe why some of the vaccine hesitancy was documented. I want to get your thoughts, now that we're through that pandemic, why is there so much vaccine hesitancy occurring now?
Yeah, and this is the crux of it, right? We want to talk about exactly why this is the case. Why are the rates dropping? Why are people becoming hesitant about vaccines? Now, I've scribbled down a few thoughts on this. I think social media is a big one. There is this kind of echo chamber of people will report something that's happened or a belief that they have, and that will then get magnified and spread around. Now, there's RFK, there's the actual health secretary in America, who, again, has challenged these links between vaccines and potentially deleterious effects. So autism, he has raised concerns about particular preservatives in vaccines. He's also raised distrust of regulatory agencies, said that essentially they're not being honest with us. He's also saying there's lack of independent testing. And actually, this goes back to what we were saying about COVID. But he suggests that vaccines should be subjected to the same sort of double-blind, placebo-controlled trials that other pharmaceuticals are used. So there's a lot of negativity coming out of that from very big names out there. Now, I think it's probably fair to say that there is or there can be a general distrust of scientists. I don't know. I wonder whether that echoes back to COVID times where people were saying things, they were projecting things, and then suddenly the goalposts would change and we would know something else. And I wonder whether a bit of the mistrust is coming from there.
Yeah, there are a few other kind of notable times in history that I think are quite shocking, and I think do explain why potentially certain ethnic groups might be skeptical of doctors. So this was done in Alabama, and this was a collaboration between a university there and the CDC. I think it was between the 1930s and 1970s. They essentially studied the impoverished African American sharecroppers. And what they did is they studied, I think 400 of them had latent syphilis, and there was a control group of about 200. And they basically lied to these patients who had syphilis, telling them that they were going to receive, excellent medical care and that they were going to get special tests done. But what they were actually doing was kind of medical diagnostics, things like lumbar punctures, telling them that they had bad blood. What they were actually doing was studying how the disease would progress in these black adult males when left untreated. Obviously, this came to light later down the line, and there was a huge uproar. But this is, the CDC. This is a part of the governing body in the States. This is hugely problematic when going forward, when you're trying to invoke, better trust and more compliance with vaccinations. This is a great example of an exploitation of trust.
Yeah, that's horrific. I mean, and I think you're right to highlight that. And there are countless other examples of that throughout history, without a doubt. I don't know about you, Matt, but professionally, I still see a few patients who will come in and will not want to have vaccines or will not want their children to have vaccines. The main reason for that quoted is safety or safety concerns. That's actually quite a rarity, and that's reflective of really the area of the country that I work in, I think. But what I do see a lot more of is concerns about additives. And actually, RFK, who we've alluded to, he raised these concerns repeatedly. He's saying he's not against vaccines, but he's against the additives that are used. So it's worth just dwelling briefly on those. So the one often quoted is aluminium. So aluminium is absolutely used as an adjuvant in vaccines. And the reason for that is because it's effective. The purpose of aluminium is to provoke a stronger, more robust immune response, essentially to the vaccine's active ingredient. And it makes that vaccine more effective and longer lasting. Without an adjuvant, the immune response it's pretty weak, and it might not even be protective. So that's a concern. People say, I don't want aluminium injected into me or my children, which, I think on the face of it sounds very reasonable. Key is the detail here, though. So the amount of aluminium in a vaccine is tiny. So it's less than 1 milligram per dose. And to put that into perspective, a baby's daily exposure to aluminium from breast milk, formula, or food, it's far higher than the amount found in a single vaccine dose. So I think infants can ingest up to 10 milligrams of aluminium from formula in a single day. This is not abnormal in many ways. It's also worth pointing out that, aluminium is I think the most common metal in the Earth's crust. It's natural in the environment. the human body is well equipped to process and excrete aluminium. So, again, worth pointing out those details. Now, there are a couple of additives that potentially do have issues. So thimerosal is one. Essentially, this is a mercury-based preservative. It was used in multi-dose vaccine vials to prevent the growth of bacteria or fungi when they were opened. Now, people were concerned about mercury exposure and a potential link to neurological damage and autism again. Now, actually, as a precaution, thimerosal was removed from almost all childhood vaccines in the United States in 2001, and I think similarly in the UK shortly afterwards. Interestingly, the rates of autism continue to rise, and that kind of potentially debunks this causal link. But thimerosal is not in any of your standard vaccines that you or your children will have. Couple of others just briefly to mention. Formaldehyde, it's a carcinogen in high concentrations. It's sometimes used in the manufacturing process to inactivate viruses. The human body naturally produces formaldehyde, and the amount found naturally in the human's body is far greater than residual amounts in a vaccine. So those are probably the ones that I get asked about and that people have concerns about. A lot of queries that come through and say, yeah, want to have the vaccine, but just want to check that it's not got aluminium in. So worth just dwelling on that just for a moment.
It's odd that RFK seems to have it in for these additives. Now, I agree, unnecessary additives into anything I have a problem with. But again, he should be surely looking at kind of the risks and the benefits of vaccines. Is there any evidence that aluminium, for example, in vaccines is causing harm versus the benefits that they're having? And again, like you said earlier, this kind of notion of challenging something is quite pervasive and then casts a doubt, particularly to the broader public. You mentioned about social media as well, Mike. And look, I think it's obvious why people are skeptical of social media, but there's a really great Professor Helen Bedford, who is a bit of a kind of leading voice on vaccines and vaccine hesitancy. And she's done some really great work looking into whether or not it is actually social media that's to blame. And she's actually presented some studies that explored this link. And I'll just run you through this briefly. These studies asked parents, literally, who do you trust with information on vaccines? And it gave them a list of doctor, nurse, healthcare professional. Social media was an option. The answers were very encouraging. She says that healthcare workers came out, right at the top, and it was only 5% of respondents that trusted social media for information on vaccines. First, I want to commend the work of Professor Bedford and the amazing work she's done in this field. However, I would strongly challenge lauding this as a victory. I think 5% is startling. I think that's way too high. I would also suggest that there's a fair portion of those who are answering against social media that probably don't want to admit it, and keeping their true reservations around who to trust private. But also this 5%, if 5% of people are trusting social media for their information on vaccines, 95% of people to be vaccinated to achieve herd immunity for measles, 5% is a lot. So I think calling this a success and that the trust in doctors is high, I don't think that's good enough.
Yeah, absolutely. And I think it harks back to what you alluded to with the complications from the COVID vaccines, is that those anecdotal, those true life stories really resonate with people. So it's all very well us as healthcare professionals saying, look, this is the scientific evidence, this is what is proven, these vaccines are safe, they are effective. But actually, is that as powerful as someone's account on social media of their autistic child, whether they perceive that's related to the vaccine or not? It's a very powerful, emotive account, or it can certainly be. So I think it's that power of the anecdote, which can be very scary and very, very influential for people as well. I guess the other thing that occurred to me just about hesitancy is we've talked about how awful these diseases are, but I think the vast majority of people have certainly never seen these illnesses, potentially not even heard of a lot of them, and that is the victory for the effectiveness of vaccines. But it also means it's kind of out of sight, out of mind. So if you said to someone, look, you need to get this vaccine, otherwise you might get this illness. But if they've never heard of the illness, or they're not worried about the illness, they've never known anyone who's had it, it's quite an abstract thought. It's quite well, I don't need to get that. I've never really heard of it. It's clearly not a big issue. And actually, as long as 95% of other people get it, then it's not going to be a problem for me.
Is it worth? Is it worth saying? In fact, yeah, I'm going to go there. Is it worth that some of the hesitancy is to do with the distrust in politicians as well? We've heard politicians saying Brexit would never happen, and then what happens? Donald Trump would never get in power. Then it happens. And then we've got Boris Johnson, who bloody hell, I've just mentioned his name again. I just think that obviously the mistrust of politicians is deeply entrenched.
People in authority, isn't it? I suspect that's likely to be a big feature as well. So we've talked about, I think, some of the reasons for why vaccine hesitancy might be there and why people are concerned about vaccines. I wanted to ask, Matt, has that ever been a concern for you? I mean, you alluded to some concerns when giving advice in COVID, but do you have any concerns? Are you worried about this? What are your views on the safety of these and how important they are?
In short, my answer is no. I have had moments where I've questioned my beliefs, certainly in COVID times when we talked about earlier, when it was so expedited. But I think, look, we're going to sound like broken records here, but I think for good reason that I trust vaccines, and I think the processes that pharmaceutical companies have to go to make vaccines is vigorous, and I think that was vigorous in COVID times as well. I think that vaccines are a victim of their own success, and I think, like you said, they've been so effective in mitigating, even eradicating some of these diseases, so that we're able to live such a unafflicted life without these crippling mortal diseases. I think we now just take it for granted, and I think it's then easy to attack something that is, like I said, it's the victim of its own success. I think a society without these diseases can then neglect their effectiveness and zoom in on, with a blinkered view on what may be just small side effects. I think headlines about how great vaccines have been is boring, and whilst the mystery and the uproar that can be started by misinformation, like you said, the power of the anecdote, a false claim of tragic consequences can easily capture our imagination, particularly for a susceptible audience. But to follow up with my own kind of intentionally sensational statement, that I think without having an effectively immunised community, young children, infants, babies, some are going to die from measles, and I think that's incredibly sad. So what are your personal takes on this, Mike?
Vaccines, for me, and this whole anti-vax concept is one of the very few things, very few controversies or debates in life that I am absolutely, totally dogmatic about, and I can't be the pragmatist that I am in lots of other realms of life. So, and actually, I've got quite angry in the past about these things. I think, why are these selfish people putting my children and other children at risk? I think I've mellowed a little bit, and I think the reason for that is I think there are still people who are absolutely guilty of spreading disinformation, of spreading fear, and costing lives, to put it bluntly. But I think actually, yes, they are there. There are a whole load of other people who don't want to get the vaccines because they've been fed this information, or they don't have access to it, or no one's told them how important they are, or they're not getting access to any healthcare, let alone vaccines. I think I have mellowed. I think I've become a little bit more understanding of where this hesitancy is coming from. And I think it's all very well for me to say, this is ridiculous. Come on. It's so obvious. Get your vaccines. But, I've had a lot of privilege in life and also had a medical school education. So I'm coming from a position where a lot of people are not, if that makes sense.
We've talked about some of the smaller contributors into vaccine hesitancy, but I think we should certainly put into this episode that a lot of the statistics for those parts of the population that aren't vaccinated is not necessarily because of vaccine hesitancy, because of choice. There is a strong link between poverty and between access to vaccines, and between education, between language. There's lots of barriers to kind of for getting huge parts of the population vaccinated that really shouldn't be there. But I guess is the remit for a whole other episode in itself.
Yeah, absolutely. And I think that's exactly the point I was trying to make, and I think you said it a lot more eloquently. But I think there are so many other considerations to this. Is not, even though the people shouting about how vaccines are going to make you into a 5G mast is very loud and very annoying, that's actually not the pervasive view in most people. They have concerns that are born out of a place of concern for them or their loved ones. So I think it is important that we remember that. So, Matt, we've talked about these waning rates of vaccinations and these rising rates of vaccine hesitancy, but let's get down to the nuts and bolts and practicalities. So, what can be done? What can we do as healthcare professionals, but actually, what can we do as members of the public to encourage vaccine rates to start to rise again?
Yes. And this is really tricky, isn't it? I've looked at some interesting stuff. I'll give you one case. So there was, this was in COVID times. There were 6 GP practices that tried to tackle this themselves. This was in a particular part of the UK that was struggling with vaccine hesitancy towards the COVID vaccines. And these 6 GP practices, they tried everything and they studied it and they came up with some interesting research. They went on the radio stations, they put up pop-up vaccine tents in opportune places, they worked with faith leaders. What they found is quite interesting. They found that what worked most of all was the one-to-one conversations with a healthcare practitioner and a member of the public to have a two-way discussion about vaccines. This was the most effective, and they found that 90% of those conversations that happened resulted in that person booking a vaccine. More compellingly, out of those booked vaccines, 95% of them actually turned up to their appointment. Now, discussions with healthcare workers clearly works in this example. I guess is it practical to say, okay, we need to go and talk to individually all of the population that haven't had a vaccine? I think certainly that's very time consuming, but was quite an interesting takeaway.
Yeah, I read about that too. And I think it was a really kind of really interesting study and exercise in patients and actually understanding where people's concerns are coming from. That's contrasts very starkly with what they do in Australia. They've got something that's called no jab, no pay in various states in Australia. So what that means essentially is that if you don't vaccinate your children, you will miss out on subsidies. So you will miss out on something called the family tax benefit, the childcare subsidy, and that applies to children and young people up to 19 years of age. So to be eligible for that payment, a child must be fully immunised, be on a recognised catch-up schedule, or have an approved medical exemption. And actually, the policy specifically removed the conscientious objection exemption, meaning that philosophical or personal objection to vaccinations is no longer a valid reason to receive benefits. They've also got another policy in play in various states called, very similarly, no jab, no play. So in addition to financial penalties, various states will only allow children who are fully immunised to be enrolled in early childhood education. So if you don't vaccinate your children, they ain't going to preschool, they ain't going to nursery. So this is the classic kind of stick as opposed to the carrot, isn't it? And it feels very extreme. And I wonder, you potentially get results the hard way. It's very likely not to be changing people's underlying views. I mean, I think my takeaway from this is, having been quite impassioned and at times become quite frustrated and angry, the answer clearly is by not getting angry. Getting angry or judgmental, calling people idiots, it's not the answer. As you say, time probably doesn't allow those individual conversations one-on-one, but I think that is the answer in terms of actually understanding where people are coming from and having informed discussions and laying things out quite simply.
I'm really glad you mentioned that, because I wanted to mention about how we approach the language. I mean, I see this firsthand with my wife and kids. Telling them to do something doesn't really work, or when I'm told to do something, I get this kind of like, I'm definitely, I'm not doing that. Like, stop telling me what to do, kind of thing. There's a way of approaching someone, and I think
I've seen that firsthand.
And I think if you give someone the evidence, if you can present to them the evidence, or present to them, try and get them to do the reasoning behind a decision, ask them for the pros and cons, letting them make an informed decision is a much more effective way of getting compliance with this. My final point, this is slightly related, but interestingly, one approach that the UK government has adopted recently with regards to overseas surgeries and these radical treatments that you can get done in Turkey, etc., these Brazilian buttock injections and things that are going catastrophically wrong, is they're now trying to fight fire with fire. They're employing influencers. They're taking those who are, prominent and voices on social media with huge followings, and the government are actually trying to get them now to spread language that warns of these treatments and warns of these various things that can happen overseas. And I think that's quite a kind of clever approach from the government. And Mike, I don't think we're quite influencers yet, but I guess hopefully we've reached a few people with this episode today, and I'm hoping that we've broadened the understanding of vaccines on a whole.
Yeah. Thanks, Matt. I think a really good episode to do. I hope that's been informative. Please, as always, spread the word, like, subscribe, and keep listening to Beyond the Limits.